Hello, welcome to my YouTube channel, guys. Today I am going to make a new video, so please whatever. Please I.
Hey everyone, today my topic of discussion is circle of Willis. Before getting into the topic, we must discuss the anatomical axis, the anterior-posterior axis, the spinal cord which is present anterior-posteriorly in the body, but the brain which is present perpendicular to the body causes the rotation of axis, thus the axis rotates and the structures which are present dorsally comes as the superior structures and the structures which are present ventrally known as the inferior structures or vice versa. Circle of Willis is present in the interpeduncular cisternae, which is the area where the CSF is in loose contact with the arachnoid and pia mater. Here we can see the interpeduncular cisternae. Then it is formed by the branches of two extensive system of arteries, which is vertebral artery system, and the second one is carotid arterial system. Carotid arterial system is contributed by mainly internal carotid artery. Formation of circle of Willis. Two vertebral arteries ascends upwards and forms the basilar artery. Basilar artery then ascends upwards and bifurcates into the posterior cerebral arteries. In between it gives the labyrinthine branches, pontine branches, and then internal carotid artery comes into the cranial cavity through carotid canal and pierces through the cavernous sinus and gives middle cerebral artery. Then it gives the anterior cerebral artery. It gives ophthalmic artery. It gives the branch known as anterior choroidal artery and posterior communicating branches with the posterior cerebral artery. Anterior cerebral arteries anastomose or connect with each other through the anterior communicating branch. If we locate all these arteries as the dots or circles 1, 2, 3, 4, 5 and 6, it forms a hexagonal structure known as a circle of Willis. Here we can see in the inferior view where we locate intercarotid arteries, where we can locate the anterior cerebral artery and posterior cerebral artery. By connecting them, we can form a hexagonal structure. As we move further into the topic, we mainly focus on the clinical manifestations. First, we will start with the occlusion of anterior cerebral artery. If there is an occlusion of anterior cerebral artery, it will hamper the supply to the somatosensory cortex and motor cortex, mainly to the medial part. The medial part represents the lower limb. Therefore, the contralateral loss of sensations and motor function of lower limb can be seen in the patients in which there is occlusion of anterior cerebral artery. Secondly, there is a middle cerebral artery. It supplies to the primary cortex and somatosensory cortex, more to the lateral part. It represents the upper limb. Therefore, contralateral loss of sensations and motor functions of upper limb can be seen into the patients of middle cerebral artery damage. Third, the anterior choroidal artery. The anterior choroidal artery has a long subarachnoidal course, as well as it has a narrow lumen, which makes it more prone or more common site for the thrombosis in brain. Therefore, it is the artery of cerebral thrombosis. Then, the ophthalmic artery. It's the most exciting structure present over there. Cause ophthalmic artery gives the branch known as the dorsal nasal artery, and it anastomosis with the another artery known as the angular nasal artery, which is the branch of facial artery. As we see, ophthalmic artery is the branch of internal carotid artery. and the facial artery is a branch of external carotid artery. Therefore, ophthalmic artery plays an essential role in the anastomosis of internal and external carotid arteries. Another structure is anterior communicating artery. It is the most commonest site for the berry aneurysms. If there is a rupture of any berry aneurysm, there is a underlying medical condition called as a subarachnoidal hemorrhage. This is a severe medical condition. Thanks for watching the video. Do like, comment, share and subscribe because views, comments and subscribers are extremely important.